Hi, this is Dr. Tieche with your MedMinute question of the week. So this week's question is about Hashimoto's thyroid issues. And so Hashimoto's really, how does it present itself? How do people know that they have it? So Hashimoto's thyroiditis is what it's called. Basically, it's an inflammatory marker. In other words, people have antibodies that are directed towards their thyroid gland. And what it does is the symptoms that people usually experience of it, there's no red lights that come on and say you have Hashimoto's. The way it is that people typically have symptoms of low thyroid, which are fatigue, dry skin, cold body temperature, difficulty with weight, hair loss, things like that. But since it's an inflammatory condition, in other words, it can be also an autoimmune marker. So people may have painful joints, things like that, or gut disruption, which is another primary cause of it. In other words, people may have gluten sensitivities, tend to experience high levels of antibodies, dairy sensitivities as well. So there's a lot of things that cause it. It really is just sort of gives us an idea to look further. It's not like a diagnosis in and of itself and a treatment in and of itself. It says here, we have a lot of antibodies that are directed towards your thyroid gland. That's what that is about. And then now we got to try and figure out what's causing it so we can reduce those. Typically, the things that we do while we're working it out is try to give people medications to treat the low thyroid if that's what's needed. But more importantly, we want to give supplements. And the supplements are meant to help repair and strengthen the thyroid tissue. Those generally include things like iodine, selenium, chromium, manganese, the trace minerals that make your thyroid function its best. Some of the things that people might notice when they have Hashimoto's is their thyroid gland might be swollen. And what that means is they might feel a fullness in their neck. They'll say, gosh, my neck looks like it's fatter, or people might notice that there's something going on in there. And sometimes even people experience a little bit of difficulty swallowing. They'll feel like, when I swallow, it's just a little bit more full in that area. So Hashimoto's by itself is not necessarily a thing, but it's something that kind of leads us to look for other things. In other words, the primary thing that we look for is low thyroid and or inflammatory conditions that are making it worse so that we can try to cut it down. There are some medications that we can sometimes use, like low-dose naltrexone to lower those antibodies. But having the antibodies by themselves doesn't necessarily mean anything good or bad. It just means there's inflammation. We don't like that it's attacking the thyroid, but sometimes you could go through the whole workup of someone, not really find a cause, and people are left with it. So then we are doing what's called supportive care. We continue people with the thyroid support supplements, and then we also, if needed, treat people's low thyroid with thyroid hormone. So Hashimoto's is different than another condition called Graves' disease. And in Graves' disease, people make too much thyroid hormone. Typically in Hashimoto's, it's low. So I hope that clarified that question for you, and enjoy your week and come back for some more Med Minutes.